Hi, I'm Dr. Chase Hayden from the Hayden Institute, and today we'll be talking a little bit about neck pain, and why you have it, what you can do about it, and why it may not even be coming from your neck. If you want to find out more about me, you can go to www.hayden, Hayden, institute.com. Find out all about me, follow me on Twitter, Facebook, find out more YouTube videos, etc. I post a lot of information there from my website, and that is the website for our office, the Hayden Institute here in Houston, Texas. So let's talk about neck pain. Neck pain is a very common complaint of patients that come in through our office. In fact, it's a common complaint among most Americans. It's estimated that over 2/3 of all Americans will experience neck pain at some point in their life, and unfortunately it's the third most common cause of pain in the United States, followed behind back pain and other systemic conditions. So with neck pain, there are a lot of causes. Traditionally, we think of chiropractors as the experts in neck pain, and also orthopedists. So if it's bad enough, you have surgery, whether it's fusion surgery or supportive procedures done through an orthopedist. If it's not bad enough and you're looking for conservative care, you go to the chiropractor or the physical therapist, etc. As a chiropractor myself, I see a lot of patients with neck pain. Unfortunately though, not all neck pain is treated the same way, and it's not all from the same origins of pain either. So traditionally, there's a structural basis to pain. And when I look at patients, I look at them from three main components. Basically, it's the triad of health. So in applied kinesiology, which is one of the techniques I use with chiropractic, we look at what someone's structure is doing. So how are their bones moving, how are their muscles, their joints, their ligaments, etc. We then look at their chemical side. How is their nutrition in their body doing? Are they vitamin deficient? Are they mineral deficient? Do they have enough chemical activity to go on? Or are they toxic? If they're too toxic from the bowels not being able to eliminate, that can back up and cause problems. Or if they have heavy metal toxicity or chemical exposure, that affects the chemical aspect of this triad of health. And then we've got the emotional side. Are you stressed? Are you grinding your teeth from the stress and that's causing the pain through the muscles to radiate? So, what's going on in your body from a structural, chemical, or emotional standpoint? Well, it's not any different with neck pain. Neck pain has these same components to it. So from a structural standpoint, is your neck pain being caused because you have a muscle spasm? Do you have a degenerative disc? Or do you have joint disease there? Or is it coming from a chemical aspect? If you're calcium deficient, a lot of times that causes muscles to cramp or to spasm. If you have manganese deficiency, that can also often cause twitching as well. That's magnesium deficiency. If you have a manganese deficiency, maybe your ligaments or your tendons are not repairing and healing like they're supposed to. Maybe you have a lot of inflammation, and taking something like essential fatty acids or omega-3s can help decrease that inflammation so that the chemical aspect of your neck pain is no longer causing the problem. Or emotionally, are you just stressed? Are you going crazy with work or school, or your kids driving you nuts, your husband, etc. Stress is a big part in the way that our bodies manifest pain and the changes in the physiology. So therefore, in our office, we like to address all three sides. Now, not all of these are treated the exact same way. So for example, if someone comes in with neck pain and it's from a muscle strain or sprain or like an injury, we're going to look at that completely different than if they come in and they have sluggish liver and gallbladder problems. Both of them can present with neck pain or neck stiffness, but they're going to have different patterns. So we like to first identify what type of pain are you experiencing. Is it a sharp, dull, achy, throbby? Is it stiff? Is it worse in the morning? Is it worse at night? What activities cause it to be worse, etc. So for example, if you wake up in the morning, you have a stiff neck, your feet and your hands are really stiff and sore, you have acid reflux, heartburn, indigestion, your knees crackle or pop, and you're constipated, there's a good chance that your neck pain is probably coming from a sluggish liver and gallbladder. Now this doesn't mean you have hepatitis or you need gallbladder surgery or something like that, but when the common bile duct begins to get thick and back up, it can start leading to what is known as a visceral somatic reflex. A visceral somatic reflex is a reflex that comes from an organ sending pain or sending a symptom through the outside part of your body. This is common in heart attacks, for example. When your heart is exploding, you get pains down your arm, up into your neck, sometimes into your throat, crushing chest pain. That's your body's interpretation of the inability of your heart to function appropriately, so it tells you in a broad pattern. Well, when your liver or gallbladder are not functioning like they should, even though it may not be exploding in the case, like in the case of a heart attack, you can have dysfunction occur and then see systemic patterns start to present. So sometimes neck stiffness in conjunction with other symptoms can mean that someone has a sluggish liver and gallbladder. So we support that nutritionally. We change the diet. We take away inflammatory foods. We put you on supplements that help support the common bile duct and thin out the bile and help the liver gallbladder function more efficiently. But let's say you were in a car wreck. Well, if you were in a car wreck, you probably are experiencing some strain sprain pattern that is affecting the neck. It's probably contributing to a sharper radiating pain because there may be nerve involvement. And so sometimes weakness in the hands, numbness and tingling going down into the arms or into the fingers can present. Sometimes neck stiffness and pain in that aspect. Similar patterns because it involves hands and neck, but different origins, different ways to look at it, different way to treat it. So therefore we do massage techniques or chiropractic care or quantum neurology rehabilitation, different neurological and structural components or different structural or neurologic aspects to strengthen up those structural components. Maybe you're just under emotional stress. Maybe your boss is going crazy at the workplace and you come home and nothing's done in your home or whatnot, and you just have emotional stress. Well, that's going to cause chemical changes. It's going to cause physiologic changes in the muscle tone and the reflexes. So therefore, that's the primary area of concern, and we could adjust you every single day, but yet your neck pain is going to keep coming back. So unless we take care of the emotional stress, whether talking to your boss about work, seeing a counselor or a psychologist about what's going on, or addressing the emotional side of that triangle of health, then the structural manifestations of your pain are going to continue to return and return. So when someone has neck pain, it's essential to not just look at the neck. In fact, a common example that a mentor of mine often uses is if you are choking like this. We all feel the pain or the loss of air coming from the choke, but this is not the problem. The problem is the hand over here that's pulling the shirt to cause the choking effect to occur. So until I remove the hand, I will continue to feel the symptoms at my neck. And then once that hand is removed, I can straighten everything else out and not have any symptoms anymore. So in our office, we like to look at the whole person and figure out what exactly is going on and why neck pain is being present. Other common causes of neck pain, besides trauma or besides degeneration, can also include systemic conditions. So in some people, their neck pain means something bigger than just a local problem like a car wreck, or means something more than just a functionally slow liver and gallbladder. These can be serious conditions such as rheumatoid arthritis, or cancer, or meningitis. So when there are certain patterns or certain symptoms, these become known as red flags in the medical industry. So therefore, like if you can't take your chin and touch it down towards your chest, that could be a sign of meningitis. If you have a stiff neck and radiating pain and it hurts all over the place and you have a fever. So that's a medical emergency. You want to get that taken care of and not just wait until your sore neck or your stiff neck goes away. For some people, radiating and tingling down into the arms or weakness into the arms or a sharp stabbing pain into the arms can mean nerve involvement. If that's the case, it could be a disc that slipped and herniated and is now affecting the spinal cord. It may not be. It may just be those sore type muscles from a whiplash type injury. But you want to make sure it's not a bigger deal than it really is. So that's why we do some testing, such as x-rays, to rule out fracture or degeneration. MRIs to help rule out soft tissue injuries, such as spinal cord compression or spinal cord involvement, peripheral nerve involvement, or disc degeneration. Sometimes we do things like nerve conductive velocity tests, where we take little needles and we stick them in through the muscles and we see how the electrical activity is occurring through the nervous system. So, and other times we do blood tests. So we screen on a blood test to see if someone has meningitis or how their liver's doing if they have hepatitis and that's what's causing the problem. And so we're able to do these testing procedures to rule out any potentially harmful problem that's going on. And barring that there's no major issue, we'd like to take a conservative approach in our office. So as a chiropractor, I use chiropractic adjustments on most patients. Not everybody likes chiropractic adjustments where we use the hands and make the popping or the crackling sensation. So sometimes I use instruments like this. This is an instrument called an arthrostim, and it's a mechanical device that just taps back and forth. This is a very gentle device, and I use it with a lot of my patients so that I don't have to use my hands, because not everybody feels comfortable whenever You know, some guy grabs their back or their neck or their feet and makes the popping sensation with a chiropractic adjustment. So I use instruments in my office. Another instrument I use for soft tissue injuries is called a vibrocussor. And this just goes back and forth. This is slightly different than a massager that you may find at your home. Massagers tend to go side to side. This one goes front to back. So as it moves back and forth like this, we're able to use it on muscle injuries and soft tissue injuries to help support the different parts of the body. So between the arthrostim, the vibrocussor, chiropractic adjustments, and I also use Quantum Neurology Rehabilitation. So in a few seconds you'll see a couple of videos of some patients that had restricted neck motion. Whenever they go down to their chest or whenever they look up, there were restrictions. There was a little bit of pain in some of these videos that I've taken. And we see a quick change just by using these instruments and rehabilitating the way their nervous system is able to function that controls these all the way up to the sky. Good. Like I said, we're looking at that angle right now. We want to see it sky. Good. We're going to do that one more. Chest down. Chin down to your chest. Good. Look all the way up to the sky. Feel the difference there.
Oh,
so
yeah.
now, so we're going to look all the way up to the sky, as far back as you can comfortably. So when we do this, we create a line that's right here on you. Okay? Instead of straight up and down. And as it happens, is that too hard?
No.
I want you to look up to the sky with your head. Keep going, keep going. Keep going, keep going, keep going. Good. One last time. Look all the way to the sky this time. Do you feel the difference?
Oh, completely.
Big difference. So now your head, so not 100%, but it's definitely... Both of those cases, they had more structural related symptoms, presentations. They didn't have to worry as much about the emotional or the chemical sides of their body. And we see a really good change with the range of motion that their neck was able to experience. So in my office, we like to look at patients from a whole body. We take into effect their chemical, emotional, and structural aspects. And even though neck pain may have been going on with them for a long time, we like to help people out. So if you have neck pain or you know someone that does, feel free to give us a call and we'll talk about what's going on with them and see if we can help them. Once again, I'm Dr. Chase Hayden, and I'm a holistic doctor here at the Hayden Institute, where we incorporate chiropractic, nutrition, and other alternative practices to help you achieve the level of wellness that you're looking for. For more information on us, please visit www.haydeninstitute.com. That's www.haydeninstitute.com. Have a great day.